What's going on, everyone? Happy Sunday. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID, flu, or any of the other viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Sunday edition of the Virus Update for Sunday, March 30th, 2025. I hope everyone's having a great weekend so far. Hopefully it's relaxing. Hopefully you're not sick. Hard to believe it is the last Sunday in March. Can you believe it? April's coming up pretty soon. You know what? April's actually my birthday month. Hard to believe 5 of my years have been spent in a pandemic. We've all spent the last 5 years in a pandemic, and now what has become virus soup. Do you want to stay informed of what's going on with virus soup? You know, all these different viruses that can make us sick. There's a lot of them out there. The best way to do that is to subscribe to my channel down below, especially if you're new to my channel. If you like this video, give it a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I'm pretty sure you're going to like today's video because guess what? We are going on a road trip around the United States, and you don't even have to leave your home. Just sit back for the next 20, maybe even 25 minutes as I take you on a road trip across the country. We'll be stopping in many different states to take a look at the wastewater data from either states or cities here in the United States. But first, we have to get through a few news stories and a few other things. Starting off in Texas, and unfortunately, there's a measles update on a Sunday. Now, it's not a statewide measles update, but Fort Bend County in Texas confirms its first case of measles. That's right. Health officials said the case involves an adult female aged 50 to 60. Fort Bend County health officials said that case is associated with recent international travel and that they are actively investigating the case. Never good when we see measles news drop on a weekend. Or a big news story for any of these viruses, really, on the weekend is not a good thing. All right, I forgot to share this yesterday or the day before, more so yesterday, but you know what? Yesterday was such a filled update that we really did not have time to share it, so we're going to be sharing a few things that we missed, but there is quite a bit of things to look at today. Flu quadruples hospitalization risk in congestive heart failure patients. Raise your hand or leave a comment down below. Do you know someone who's dealing with congestive heart failure? I can actually raise my hand to this. I believe a neighbor, several houses up, is dealing with that, or so I was told. So if someone like that gets flu, it's not a good thing. Flu patients who had an underlying medical condition were more likely to be hospitalized for their infection than those without one. And in the case of congestive heart failure, CHF, the risk was fourfold according to the Centers for Disease Control and Prevention. Yikes, that's not good. I mean, oftentimes we talk about COVID can cause this, COVID can cause that, or someone's blaming, oh, did they have COVID? You know what? We have to stop and take a look at flu too, because you know what? Flu can do things, and as stated in a virus update, I'm going to say about a month ago, I have added a section on my site for flu studies, and this study did make that. I haven't really added anything to that section. I think there's just 2 listed in there, but I'm going to be slowly filling that in, and you're going to be surprised. Flu can cause a lot of things too, and one of the reasons why we're starting to find out about that is because there's so many curious people out there. What I mean by that is, well, wait a second, we're finding out COVID can do this, COVID. I wonder if flu can. Well, there's research starting to be done, and now we're starting to find, hey, flu can cause a lot of problems too, which is also not good. But mind you, COVID, yeah, that's the one that we really are worried about. All right, let's go up to Canada for a moment. More bird flu cases found among poultry in Nova Scotia. Just pretty much wanted to read that headline. Yeah, bird flu is continuing to spread. The migration of birds probably hasn't hit Canada just yet, but it will relatively soon. All right, today is Wastewater Sunday, so let's start off the wastewater portion. Of course, we're going to look at some other things as well, but let's read this from Wastewater Scan. I've been holding this for a couple of days and saving it for today, and this is the Wastewater Scan National Respiratory Overview. They posted this on March 27th, but Respiratory Weekly Update. SARS-CoV-2 COVID, influenza A and RSV are in the high category still nationwide here in the United States. The other respiratory viruses, influenza B, HMPV, and EV-D68, are still in the low category, so that's good. Taking a look at COVID. COVID is in the high category with medium concentrations, and they're saying an upward trend over the past 3 weeks. Okay, and we do see here the Northeast region on this chart is going up slightly. COVID-19 variants in sequencing, and mind you, they're behind on their language here. We do know that the LP.8.1 variant is in the lead right now, so we're just actually going to skip over that. Influenza nationally, flu A is in the high category with a concentrations and a downward trend over the past 3 weeks. However, flu B is in the low category nationally, but is nearing onset. And we've been seeing some areas where flu B has been going up. I think when we get around to New Jersey later on, we're going to find out that New Jersey is rising slightly. H5, influenza marker, H5 detected in 25 states. So H5 meaning bird flu. RSV is in the high category nationally with high concentrations with a downward trend over the last 3 weeks. HMPV is in the low category nationally, but is in the onset in the high category in some regions, west and northeast. And norovirus is in the high category nationally with a high concentrations, no significant up or down trend over the past 3 weeks. All regions except the west remained in the high category. However, I do believe I have somewhere on our road trip where we will find norovirus is going up. There's your hint for what's coming a little bit later. All right, moving on now, we have to take a stop at the CDC. And CDC overall for measles last week, 483 cases. I would be shocked if the update of next Friday does not go over 500. We already know that that is probably 484. Why? Well, we just read off a new case in Texas. So that's already one more that can be added to that. And who knows what else will pop up during the week. Alrighty, let's take a look at birdcast and the migration of birds. And yeah, the migration season, it is definitely happening. Take a look at these numbers on the left. These are millions of birds in flight. Yeah, millions of birds in flight. There's many millions. Matter of fact, I just saw it say 80 million a second ago. But when we take a look here, and let's start this from the beginning, we can see here, there is heavy migration traffic going from portions of Texas up to the plains, the East Coast as well. You know, when birds are in high migration, you know what that means? That means the number of birds migrating to the north is high, and the potential for bird flu to spread is increasing. So we'll have to keep an eye for new outbreaks and maybe even the potential for new human cases. Alrighty, moving on. Taking a look at what is going on with the air quality levels, and we're going to see there are some areas with bad air quality. Yeah, take a look at what's going on down in Texas. You're seeing a lot of oranges, and we can see the West Coast, there's definitely some problems as well, and just generally a lot of yellows in the east from the Appalachian Mountains up into Pennsylvania, even portions of the Great Lakes, southern New England, the immediate coast of the Carolinas, Virginia, Georgia, not terrible, but again, inland, there are definitely some problems ongoing there today. Taking a look at what's going on with EMS calls. In Pinellas County, Florida, we do see that there are a few calls, breathing problems showing up several times, including sick person call. And in Philadelphia on Friday, and I do need to refresh this, 780 EMS incidents were reported on Friday, or excuse me, yes, on Friday. And finally, here we go, Saturday, 805 EMS incidents. So that was up a little bit, and it was just posted, or it was just posted 8 minutes ago, so I will retweet that. All right, taking a look at what was going on in the past week with Philadelphia when it comes to influenza, and taking a look at influenza, we do see in emergency departments that is dropping at this time. It continues to drop for influenza A, and here's overall influenza A. But take a look at influenza B, and I'm going to show this to you. I'm going to magnify this, and I want you to see this because it's not letting me do it. But the point is, you can see it here on the right. It is continuing to rise. So influenza B in Philadelphia is still rising. This is not a good thing to see influenza B continuing to rise. All right, Philadelphia is where we're starting our road trip. Now we're going to go out just a little bit to the west to Montgomery County, Pennsylvania, and we're going to take a look at the EMS incidents here. We see there are only 9 right now. Not many. Head injuries, fall victims, vehicle accident a couple times. Generally, it is not a bad day in Montgomery County, Pennsylvania. You're not seeing respiratory emergency. And now taking a look at what's going on in Chester County, Pennsylvania. And yeah, Chester County, Pennsylvania, yeah, there's some problems there. A few respiratory difficulty calls and a couple sick person calls. EMS standby, so that's just standby at a sporting event or something. So overall, not bad there as well. Now let's take a look at the rest of the state of Pennsylvania and see what's going on with the hospital situation. And we do see, when we take a look at Pennsylvania's hospital situation, not bad. A lot of green, few yellow hospitals, but let me tell you something. If you've been watching my channel throughout the winter, you know what this was like just a month or two ago. There were so many problems so many hospitals dealing with problems. Not seeing that today. Just a few hospitals, and some of these I don't think I've updated. And now taking a look at the statewide COVID levels, and we can see, yeah, they went up ever so slightly. You can't see the chart here. I'm blocking it, but we can see COVID level is low. The latest variant in Pennsylvania is the LP.8.1 variant, and that is at 34% of the cases. And there's this other category. I don't know what the variants are or which variants are within that, but that makes up 30% as well. That's a large percentage. Influenza A in wastewater continues to drop at this time in Pennsylvania, and RSV also continues to drop at this time. All right, let's go to the next stop on our road trip, and our next state will be New Jersey. And first off, take a look at the hospital situation in New Jersey. Hey, everything is doing fine. Just a specialty issue at RWJBH University Hospital in Rahway, New Jersey, so not terribly concerned about that. And let's take a look at New Jersey's summary, and we do come to something interesting in this. And we do see that the test positivity for COVID-19 and influenza increased when compared to previous weeks. The percent positive for seasonal coronaviruses, and I have to scroll this to the right, is high, and there have been increases in test positivity for rhinovirus and enterovirus. Levels of COVID-19 in wastewater remained elevated, while elevated COVID-19 levels remain lower than the summer of 2024 peak. That's good information. Here's where it gets a little interesting. Levels for influenza type A are declining. However, influenza B is increasing. RSV levels in wastewater continued to decline at this time. And moving on now to our next state, which would be New York State. Let's go over that George Washington Bridge, and let's go take a look at what's going on in New York City. We'll zoom this map in. Well, of course it's going to refresh on us, but in New York City, we're still seeing a lot of orange and red. What does orange and red mean? Well, orange and red are areas that are dealing with some moderate to high levels of wastewater, so that's not necessarily a good thing. And we're still seeing some moderate to high levels of wastewater in western New York State, closer to Lake Ontario and Lake Erie. And then the rest of the state, unfortunately, there's a lot of wastewater sites that are not updating, but I am seeing some blues showing up here. And blues are low levels, maybe even moderate. Some of them are showing up moderate. There's 58 moderate sites, I believe, here in total, or something like that. So, yeah, there's some areas that are showing up moderate at this time. All right, let's go further to the west. We're going to have to drive through Pennsylvania again to do that. And this time we find ourselves in the state of Ohio. And we're going to take a look at Ohio's dashboard, or respiratory dashboard for wastewater. And I believe this is mainly going to show COVID. Yes, increasing COVID levels is being seen at 5% of the wastewater facilities. 11% are increasing for influenza. Well, high levels are being seen at 11%. And high levels of RSV are being detected in 7% of the facilities. Overall trend in Ohio for COVID at this time is decreasing, and the level is moderate at this time. So that is some good information to report on at this time. And take a look at Columbus, Ohio. Moderate for COVID, low for influenza. Let's go up to near Cleveland, can we? Take a look at that. Everything's decreasing at this time. Cincinnati. Yep, looks like Cincinnati is either steady or decreasing at this time for COVID. Influenza and RSV not available there. How about Toledo, Ohio? Steady for COVID. Your level is moderate. And steady for COVID, decreasing for influenza at another wastewater site there at this time. All right, let's continue our drive to the west. Unfortunately, nothing for Indiana or, nothing for Indiana. I didn't check to see if I have anything there because we have so many more places to stop at. And our next stop is going to be in Chicago. Maybe we'll get Indiana on wastewater scan. If not today, definitely tomorrow. And in Chicago, when we take a look at wastewater data, when it comes to COVID, you can see here in the last week, it actually went up ever so slightly. Not terribly concerning. It's just a very minor increase. Taking a look at what's going on when it comes to RSV. RSV in Chicago is dropping. Now, how about influenza B? Because we've seen some areas rising for that. Well, that's not the case in Chicago. Chicago is dropping at this time. Influenza A in Chicago, yeah, it's still dropping, but that has slowed its drop just ever so slightly. Not terribly concerned about that at this time. All right, now we're going much further out west. We have many states to pass through, some which don't have data. I hate to say that, but there's a lot of states that don't bother to have data for whatever reason. And we find ourselves now in Colorado. In Colorado, COVID at this time is increasing in just one wastewater site. 13 wastewater sites still detecting levels of influenza, 17 with RSV at this time. And yeah, there are still some problems in some of these wastewater sites. And we can see here that for the most part, there's a steady decrease when it comes to these viruses, when it comes to COVID on this map. So that is some good news at this time. There's just one that's Boulder County is increasing a little bit. And let's see, there's one that's also, a couple of them are in plateau status at this time. Now we're making our way a little bit more to the northwest. And it's Washington that we stop at this time. And we can see in Washington, there's some oranges, and I almost want to say bright orange, red color. There's a few places here where there's still some problems ongoing when it comes to COVID at this time. And there's some blue. Blue is lower levels. But, yeah, some of these areas are seeing some increases when it comes to COVID. Influenza is not doing bad at this time. Influenza is really doing well. And when we go to RSV, RSV is doing okay at this time as well. The point I'm trying to make with influenza is that the trend is for it to finally continue to come down. And I think influenza will continue to drop. When we take a look at COVID hospitalizations, I'm just noticing here they're showing hospital beds in use when it comes to COVID. That number in the past week looks like it has leveled off a little bit after it was dropping. It even went up ever so slightly. I'm not terribly concerned about that at this time. Now we have to go down that Interstate 5 corridor, and we find ourselves in Los Angeles. And we see in the past week, Los Angeles, when it comes to COVID, that saw a little bit of a rise. Yeah, take a look here at this reddish orange. Yeah, it's gone up ever so slightly. I mean, how long could it have kept going down? It couldn't. Why couldn't it keep going down? I'll tell you why it couldn't keep going down. Because, you know what, they got hit really hard last summer, but that was a long time ago. Some immunity from that is going to be starting to wane off. I don't think they're headed to the next wave, though, yet. I think we're going to be in this bouncing off the bottom period for a while, and eventually, at some point, it will start to go up, probably still many weeks away from that. I don't know if it's going to be the end of April or if it's going to be some point in May, but at some point, they will start going up again, like they did last summer. They're going to have a summer wave. Now we have to go east, and we're going pretty far east, but not to the East Coast just yet. Oklahoma is our next stop. And first off, we see the COVID risk in Oklahoma is moderate. Flu and RSV risk is low at this time. And we can see here, when we take a look at wastewater for COVID-19, we can see that's dropping, but the positivity rate, and I mentioned this yesterday, CJS mentioned this as well, the positivity rate for COVID has been going up. So that's telling me, I think more people are just not getting tested at this point, and that is causing there to be an increase in the positivity rate because we're not seeing it show up in the wastewater just yet. Now taking a look at what is going on when it comes to wastewater levels for RSV, we can see that RSV does continue to drop across Oklahoma. As for influenza, I cannot show you wastewater data for influenza. They actually say here, publishing of wastewater data has temporarily been paused to ensure the quality quality of the data is okay. Yeah, I'm sure states really care about that. I mean, if more people in states cared about that, we would be seeing daily virus reports on the news every day. We're not, so moving on. We have to go a little bit further south now on our road trip, and this takes us down to the city of Houston, Texas. And this is the second time we've been to Houston today. Remember that measles case just outside of Houston, Texas. And wastewater there for COVID at this time is dropping in a few places and holding steady in other places. Not seeing anywhere that's really rising at this point. So that is some good news. Now going to a dashboard that I don't know that we have ever looked at before. Orange County, Florida, wastewater. Yes, take a look at this. Top in our vehicles and let's get there, shall we? And when it comes to COVID, you can see here, there are several different regions. And I hate to say it, overall, Orange County, Florida, this could be a product of spring break. A little bit of an increase ongoing for COVID at this time. You can see the eastern wastewater facilities going up a little bit. Southwest Orange County's going up a little bit. Northwest has gone up slightly. We can see South Orange County's actually dropped slightly. Surprise, I mean Disney's down there. And take a look at this. We are seeing some of these regions rising once again for norovirus. Yes, the eastern region and that one in orange. What is that? That's Southwest Orange County. Yeah, that's starting to rise once again. Maybe that's where Disney is in this wastewater system that they have here. And we can see here, even in the south, yeah, that's rising as well. So, yes, I said there was somewhere that was rising once again for wastewater, and here you go. It is in the Orlando metro area in Orange County, Florida. How about that? All right, we have to take 95 now and go north. Well, got to get on I-4 first. And this time we find ourselves in South Carolina, and unfortunately, in this case, I don't think we actually have wastewater data here. We just have an overall look at what's going on with the viruses. COVID-19, influenza, RSV, all seem to be dropping at this time. Now let's go a little bit west. We're going to find ourselves in Georgia, but it's not for Georgia's dashboard. It's not for Atlanta's dashboard. What could be in the Atlanta metro area that we need to look at? Well, it's the CDC. The CDC headquarters is in Atlanta, Georgia. And taking a look at the overall CDC map here, hey, things are not doing too bad. There's a lot of blue in the west, and blue means low levels of COVID. But there's still some orange and red. What's orange and red? Yeah, that's moderate to high levels of COVID. Still showing up in Louisiana. Louisiana is going to take time to recover. And if anything, they got hit so hard this winter in Louisiana, that may prevent them from having such a big outbreak in the summertime. We'll have to see. Don't hold me to that, but they did get hit really hard. South Carolina, which we just showed, when it comes to wastewater now, South Carolina, yeah, still some oranges and reds. North Carolina as well. And you know what? Those states, I think North Carolina's still been having too many deaths when it comes to COVID. Dallas portion of Texas is still having quite a bit of COVID being detected in wastewater. Ohio's not doing as bad now. And the Northeast is overall not that bad. Look at Maine. Look at Vermont. There's still a couple moderate sites up there in New Hampshire and a couple in Connecticut as well that we still need to watch out for. All right, making our final stop on the CDC's data section. And we can see overall in all regions of the United States, COVID at this time is dropping after that little bit of a hiccup, uptick, whatever you want to call it from last week. Taking a look now what's going on with influenza A nationally. And influenza A, it's continuing to drop at this time. That's what we want it to do. We want to continue to see that drop at this time. RSV at this time. Little snag here. Looks like it went up a little bit of a hook. So we'll have to keep an eye on that. Hopefully it will continue to drop again next week. Alrighty, folks, that does it for the Sunday edition of the Virus Update. We'll take a look at some wastewater sites tomorrow. I know I promised you some more states, but we'll do that tomorrow. Tomorrow we should have Walgreens data, and we should have some news of the day and whatever else pops up. If you enjoyed this video, we actually did a road trip today in today's video. If you enjoyed your virtual road trip, touring the various different wastewater data places for many different states and cities, give this a thumbs up. If you want to see more of this, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I'll see you all again next time for whatever we have tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Sunday afternoon. Thanks for watching.